Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Closing schools for summer break successfully limited the spread of H1N1 pandemic flu in Alberta, according to research published in the Annals of Internal Medicine. Here is some information about H1N1 pandemic flu. It was first identified in Mexico City and quickly spread to the rest of North America and the rest of the world. In June 2009, the World Health Organization identified the spread of H1N1 as the first pandemic of the 21st century. The pandemic was declared over in August of 2010. Researchers from McMaster University in Hamilton used advanced mathematical modeling to analyze the results of virological testing for H1N1 pandemic flu, census data, weather patterns, and school calendars in order to see if weather patterns and school closures affected the transmission of H1N1 flu. The data they used was collected in Alberta, Canada, between April and January 2009. When schools closed for the summer break, the transmission of the pandemic flu virus among school-aged children dropped by more than 50%. The drop was a key factor in interrupting the transmission of the disease. While weather patterns also affected the transmission of H1N1 pandemic flu, the impact was not nearly as great as it was for school closures. We spoke with Professor David Earn, principal investigator of this study, who offered some further insight.
So we were lucky to have access to these data in Alberta, and when we plotted up those data, immediately we saw, once we looked up the school schedule, that there was a very strong correlation between when schools closed for the summer and when there was a big drop in incidence of influenza in Alberta. Within a few days or a week or so, you could see a drop in the number of cases. And within 2 or 3 weeks, I forget exactly the length of time, you could also see a drop in the rest of the population, not just the school-age individuals. So that immediately was very suggestive. There was a second wave, and if you look when schools opened, there was no immediate impact on incidence. It took weeks for there to be a noticeable exponential rise in the number of cases. But again, our modeling shows that that's what you would expect. You know, when there's hardly any cases, if you increase the transmission rate, there aren't immediately a bunch of cases, but it can spark the growth of another wave of cases. So it was, again, confirmation that schools being open or closed had a big impact.
Today's research suggests that closing schools should be seriously considered as a measure for controlling the spread of future pandemic illnesses such as the flu. For Insider Medicine in Depth, I'm Dr. Susan Sharma.